Hi everyone, welcome back to our channel. I'm Mark.
And I'm Mary, and in this video, we will tell you all about the Workplace-Based Assessment Program, or the WBA.
The WBA is a pathway for IMGs to complete their requirements for general registration. In particular, for those IMGs who have completed their AMC1 and are currently employed in a hospital offering the WBA program.
The WBA program is only offered in selected hospitals throughout Australia, and you can visit the link below to view the list of the hospitals offering this program. We are very excited to let you all know that we have been accepted into the WBA program for 2024.
We are looking forward to share with you all more information about the WBA program, including our opinions and tips.
This video will be the first of our WBA program series, so don't forget to subscribe.
The main advantage of the WBA program instead of the AMC clinicals is that there is a significantly higher passing rate compared with the AMC clinicals, approximately more than 90%.
The second advantage of the WBA is that the assessments are spaced throughout a span of 10 months, which allows you more time to prepare in between.
Third, the WBA program has a lot of workshops that are very informative.
The only disadvantage of the WBA is that it is significantly more expensive than the AMC clinicals. It is around 13,000 AUD compared with the AMC clinicals, which is around 4,000 AUD. However, the payment for this is made in installments throughout the months.
Keep in mind that the information that we are going to share in this series is solely based on our personal experience in our own hospital, and it might differ from other candidates' experience from other hospitals.
The first thing that we will talk about is the eligibility criteria. To be eligible for the WBA program, you must fulfill certain criteria. So first is that you must be a full-time employee with the district offering the program for the duration of the 12 months. Second is that you must have worked in Australia for a minimum of 6 months as a JMO. Third is that you must have a minimum level 2 supervision with APRA. And last is that you must be ready to start work at the commencement of the program.
If all of this apply to you and you're interested in applying for the WBA, you need to send your expression of interest form. Second is your preliminary contract. Third is evidence of your AMC1 completion or passing, evidence of your English exam, your previous term assessments, as well as your APRA registration.
All candidates are assessed for suitability in terms of capacity to fulfill these assessments in their appointed roles.
Priority is given to those who are already working on site, for those departments where recruitment is difficult, and for those IMGs who will be commencing on time.
If you have accepted a spot in the WBA, you cannot apply for the AMC clinicals during the duration of the 12-month period.
Next is we will talk about the 4 mandatory assessments in the WBA program. First is the mini clinical examination or the MiniCX. Second is the case-based discussion or the CBD. Third is the in-training assessments, which are the end and midterm assessments. And lastly, the 360 nomination, wherein you ask your medical colleagues and co-workers to assess how you work. Lastly, the WBA committee will collate all of this information and results and will send them to the AMC for further evaluation.
For the MiniCX or the mini clinical examination exercise, the consultant directly observes your patient interaction for around 10 to 15 minutes, and this is followed by a one-on-one feedback with the consultant for around 10 to 15 minutes as well. The assessor or the consultant will rate your patient interaction and your performance using a standardized and structured rating form.
You are required to finish 12 MiniCX, and 2 of each of the MiniCX will be coming from the 6 clinical areas, namely adult medicine, emergency medicine, child health, mental health, women's health, and adult surgery.
The criteria assessed for the MiniCX are the following. So first, the medical interviewing and communication skills, professional or humanistic skills, organization and efficiency, history-taking skills, physical examination, counseling, patient education, and management skills, and lastly, the clinical judgment or clinical reasoning.
So for the global rating, it is the overall judgment of the performance at the expected level of an Australian graduate at the end of a PGY1. So you must be termed or assessed as competent at the end of each MiniCX.
To pass the MiniCX, you must complete all 12 MiniCX assessments, passing minimum of 9 out of 12 with an aim to pass everything.
You need to pass at least one of the MiniCX in each of the 6 clinical areas.
Next is the case-based discussion or the CBD. So the CBD tests your ability to discuss with the assessor the clinical reasoning and clinical synthesis involved in the clinical assessment, investigation, treatment, and follow-up on the overall clinical care of a particular patient that you have worked on.
There are a total of 6 CBD, one from each of the clinical areas. So these CBDs are usually scheduled during your current rotation to make sure that you have adequate patients that you've closely worked on, documented as well some clinical notes.
You are required to complete at least 3 of the 6 CBDs on patients with a comorbidity in one of the 5 subspecialties that you are not working on. It takes around 30 minutes in total, including 10 minutes of feedback.
Your competency is assessed through your clinical record keeping skills, your differential diagnosis and problem list, your management plan including your treatment and follow-up, and lastly your clinical judgment and clinical reasoning. So for the global rating, again, you have to be assessed as competent.
And to pass the CBDs, you need to complete the 6 CBDs and pass at least 5 out of 6. If, for example, a candidate receives a score of 2 or below in any of the criteria involved in the CBD and MiniCX, it is identified and a remedial assessment needs to be arranged for the specific clinical area or clinical skill marked as 2 or below.
Next is the 360 multi-source feedback assessment. So this provides an evidence of the performance of the candidate from the perspective of his or her medical colleagues as well as co-workers. So it is performed at both month 1 and 2 months prior to the completion of the WBA or month 8.
So the purpose of this is to help you reflect on your own professional attitude and behavior and identify areas of remediation if needed. So for this, you must submit 8 nominees. 4 must be medical co-workers and 4 must be co-workers. So for the medical co-workers, the first one should be your term supervisor, so should be a consultant, either a staff specialist or a VMO. And for the co-workers, the first one should be the nursing unit manager. So for the co-workers, you can include nursing staff, occupational therapists, physical therapists, or pharmacists. And for the medical co-workers, you cannot include someone who is also under the WBA program.
So you must complete 2 sets of self-assessment form and 2 sets of multi-source feedback assessment and be recommended as competent after a careful review of the WBA committee.
Another requirement is the in-training term assessment. So this is also known as the midterm and end-of-term assessment. So for each term of the 5 clinical terms per clinical year, you must ask your term supervisor to sign your midterm and your end-of-term.
Lastly is the direct observation of procedural skills or DOPS. This will assess your competency in doing some or specific procedural skills, which include bag valve ventilation for adults or pediatrics, male catheterization, and plaster of Paris application for a back slab.
And it also includes preparation of a sterile procedure, including gowning and gloving, also includes suturing and venipuncture or IV cannulation. And the last DOPS can be any procedure of your own choosing. It can be female catheterization, it can be vaginal examination or pap smear, it can also be NGT insertion, and what else?
lumbar puncture for adults, thoracentesis or paracentesis as well.
So if, for example, you do not agree with an assessor's rating of your performance in either the CBD or in the MiniCX, there is a candidate's appeal process, and in this situation, just speak with your WBA support officer.
So lastly, key things to remember: assessment should not interfere with your roster duties. Second is dress well, avoid wearing jeans. And third is if you are feeling unwell or feeling sick, contact your assessor and reschedule.
Next is that the assessor should not be a relative or a friend. Also, it is important that you do not discuss your previous assessments and your progress with your current assessor. And lastly, you should be assessed at the end of PGY1 level.
That's it, guys. Thank you for watching. If you like this video, please give it a thumbs up and subscribe to our channel.
We will talk more about our WBA experience per clinical area in the upcoming videos. Thanks for watching.
Bye.
Bye.